As many of you know, there's an epidemic of diabetes type 2 and obesity. But I want to tell you some very good news. It is reversible. Type 2 diabetes is reversible. In fact, anyone can develop type 2 diabetes and anyone can reverse it. It has all to do with our inflammatory burden and our microbiome. We actually have an active clinical trial. We're accepting new patients for assessment of how microbiome repair and hormone balancing, our endocrinology program, can reverse diabetes. We have 10 patients right now in the trial. All of them have decreasing blood sugars progressively through time. It is definitely reversible. It is important to know, though, that untreated and non-reverse diabetes will progress and puts all of us at risk for very scary things such as heart attack and stroke, kidney disease, and chronic pain, and inability to lose weight. It also affects our brain. Diabetics develop higher risk for dementia and cancer. So it's important for all of us as a society to understand it's reversible, it's doable, and it does require repair of the microbiome and balancing the hormones. We are the only medical system overtly focusing on the endocrine system and the microbiome together for all diabetics. So we're more than just looking at the blood sugars. Other systems, they're gonna use medications to lower blood sugars. And yes, if you do that, you lower the complication rate of what happens to diabetics. So diabetics develop organ damage because of loss of the blood flow to those organs. Why? Because the high sugars lead to more inflammation, which leads to more clogging of the arteries. So yes, the medications can be helpful to prevent those complications. But what I'm talking about is reversal of the underlying cause of diabetes in the first place. And we see that the hemoglobin A1C, which is the diabetes test, we see that decreasing over time in our patients if they're working on the microbiome and the endocrine systems. We know that there is a certain signature, a microbiome signature, which is a certain type of environment, almost a microbiome footprint for diabetics. In a way, there is increasing evidence to show that every illness has a certain microbiome signature. And if we repair some of the dysfunction in that signature, we can take people out of a diabetes type physiology into healthy wellness physiology. That's our overriding goal. It then becomes easier to lose weight and to live a healthy lifestyle, which does the rest of it.
What is, in short, quickly, what is the emotional experience of the CCIM solution look like for the patient, from the patient's point of view?
I love telling people that their blood sugars and their hemoglobin A1C, which is a diabetes test, is lower with time. Because the reversibility is surprising. People don't know that. People are told they're diabetic and they're scared by that fact and they think that they're gonna die early. The reality though is that it's reversible and you can see that with repeat testing. The surprise and the amazement and the hopefulness that people have, that's just written on people's faces.